we start, I'd just like to do an opening and get us going in a good way with a territorial acknowledgement. And I'm specifically choosing the word territorial acknowledgement rather than land acknowledgement. So a person can be grateful and have respect and personal relationship with the land while still not acknowledging the Indigenous peoples who have stewarded that land. And so it is very important to acknowledge and offer respect to the relationship and care that Indigenous peoples have had with their ancestral territories and lands. And while doing this, a person also acknowledges and respects the land. And so with that, I would like to acknowledge and express my appreciation for the traditional, ancestral, and unceded territory of the Secwepemc, where I am located, and in what today is commonly known as Salmon Arm. And so if anyone would like to add your own territorial acknowledgement and reflect on your relationship and relationship that the local Indigenous peoples where you are have had with the land, please feel free to add it to the chat. Thanks. Okay, with that, just a few little housekeeping things. We have 3 presentations today. They're all going to be so fantastic. I'm so excited and looking forward to them. We're going to have 1 presentation, a little bit of questions, 2nd presentation, a little bit of questions, 3rd presentation, a little bit of questions about that presentation, and then we'll open it up again to questions for everybody at the end. So that's how that will work. We'll also be recording the presentations themselves and posting them up on YouTube and sharing them out. But the question and answer period portion of it won't be recorded or shared out. And this also has continuing education credits with for environmental health officers and planners. If that's of interest, get in touch with either Sharita or I. And I think that's it. We've tried to have a respectful dialogue, obviously, and we'll go from there. If you have questions as you go, maybe you can even put them in the chat, and then we'll work through them in that way. All right. So today's presentation, right now we're having lots of different things happening. So we're having climate adaptations are needed. We have housing crisis, and we have a group of people in particular who are more vulnerable and experience more barriers in an exacerbated experience to those climate and housing issues. And so the webinars today, our presentations today, are exploring that and discussing those things and actions and best practices that could be applied to that. So that's what the presentations are about. And we're going to get started with Kerri and Nicole. So this presentation is a development for Ontario public health professionals. It's based on the Healthy Built Linkages Toolkit framework and climate change considerations, interventions, and opportunities for collaboration will be highlighted. So Kerri, I'd like to introduce. So Kerri Klein is Director and Climate Lead at Shift Collaborative with over 20 years of experience in climate adaptation and strategic engagement. She supports multiple sectors to advance equity-centered, systems-based climate strategies that enhance health, well-being, and resilience. And Kerri holds a master's in art and environmental education and communications with a specialization in climate change leadership. And presenting along with Kerri is Nicole Heintzman. She is a climate change and health analyst at Shift Collaborative and an environmental public health services program officer at the First Nations Health Authority. She holds a master's of public health and a background in health promotion and environmental health. Nicole has supported cross-sector efforts to strengthen climate resilience through research, policy development, and community engagement. And so with that, over to Kerri and Nicole for their presentation, Climate Change, Health Equity, and the Built Environment. Thanks.
Thanks so much, Anita, and hi, everybody. I'm sorry, I can't figure out how to rename myself, so my name is just showing up as Kerri on the screen, but I use she, her pronouns, and as Anita said, I'm a director of a Shift Collaborative. And at Shift, we help different sectors, often governments or community organizations and institutions, to work better together on complex issues. And a lot of our work these days sits at the intersection of climate change, health, and equity. And we really focus on building capacity. So whether that's through strategic facilitation or hosting learning workshops or supporting collaboration across sectors that sometimes don't speak the same language. And we also develop tools and guides like the one I'll be talking about today. And what we try to do is take big ideas, big picture ideas, and really ground them in equity-informed action. So our approach is really about zooming out and understanding kind of broader systems at play, and then zooming in to identify kind of strategic, tangible opportunities to make progress, especially for those kind of populations that are most affected. Next slide, please. So we're talking about housing today, and wanted to start by expressing gratitude for the First Nations who have cared for and called these lands and waters home for countless generations. I'm joining with deep gratitude and respect today from the unceded and traditional territories of the Lekwungen peoples, the Songhees and Esquimalt nations, otherwise known as Victoria today. And my colleague on the project, Nicole, is joining from the territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. Next slide, please. So earlier this year, Shift developed a public health practice guide for the Ontario Resource Centre for Climate Adaptation called Climate Change, Health Equity, and the Built Environment. And I'm going to put a link in the chat to the guide. Hopefully that works. And so before we get into the details of the guide, I wanted to start by sharing the story of why this was developed. As Anita kind of started to frame this already today, we're living in a time of kind of multiple interconnected crises happening all at once. So some would call this a polycrisis, excuse me, where there's, excuse me, climate change, growing health disparities, inequity, housing insecurity. And on the surface, these issues might seem quite separate, but they really compound and reinforce each other. So the development of the guide was driven by this recognition that climate change is now a major public health issue across Canada. In Ontario, they had just experienced, an unprecedented 2023 wildfire season, longer and more frequent and more intense heat waves. And Ontario also has seen like a significant increase in Lyme disease. And so this is something that's been increasingly on the radar in that province and of course across Canada as well. And we know that the impacts of climate change aren't felt equally, and it's happening in a context where there are existing inequities, and climate change is deepening those existing inequities, but also creating new ones, especially for people who are facing kind of structural challenges or disadvantages. And that's why adaptation efforts really need to focus on those most at risk, and also why public health has a critical role to play. So we know that public health professionals are key players in building climate resilient and equitable communities, and they've been doing that work for a long time, with that kind of a healthy communities hat. But public health professionals also are facing their own challenges. What we heard from an advisory committee that helped inform the guide was that there's really a wide variation of internal readiness within health authorities and health sectors. Not every health unit, for example, has someone that's focused on climate change, and many are just still building that foundational knowledge about how the built environment intersects with health and equity and climate. So capacity also looks different across different regions. So urban teams might have a dedicated staff or a municipal colleague that they can collaborate with, while rural and northern teams are often stretched more thin and are covering larger areas with fewer resources. And we also really heard that's clear. What's needed isn't necessarily just more data and information. There's a lot of that out there already, but it's really a synthesis and clarity. So they were really asking for a tool that would help to distill existing evidence into kind of simple, actionable messages that they can integrate into their existing work, not really just to pile on top of it as one more thing. So, one of the most powerful levers I think that we have is to take this kind of multi-solving approach to focus on the built environment. So looking at the places that shape where we live and how we gather and connect. And so this guide is about equipping health professionals to step into that conversation with some of their partners around the built environment, climate adaptation, and health equity with some more clarity. Next slide, please. So as I said, this guide was developed by Shift for Orca in a partnership with an advisory committee of 7 public health professionals from across Ontario, representing kind of urban, rural, and northern health units. And the guide itself, it's not an extensive literature review. It really is meant to be a practice guide. So the purpose of it is really to help raise awareness about how climate change is deepening existing health inequities, but then really focusing on the role that the built environment plays and how the built environment can either kind of amplify risk or serve as a lever for reducing health inequities and building climate resilience at the same time. And it's meant to be a practical tool. So it provides key messages, infographics, some frameworks to help public health professionals engage with partners and influence policy and planning decisions, whether that's through climate smart housing or zoning or transportation or emergency preparedness. And finally, I think it's about really making those climate health equity kind of co-benefits more explicit. Things like, reducing respiratory illness through better air quality, or improving mental health through access to green space, or reducing vulnerability through affordable, resilient housing, which we'll talk a little bit more today. So it's really about showing that when we design for health, we also can design for climate resilience and for health equity as well. The last thing I'll say is that some of you might notice that some of the figures in the guide appear a bit fuzzy, and ORC is aware of that, and they're currently working with their designer to correct the resolution of some of those figures. So an updated version should be posted shortly. So I'll pass it to Nicole to just talk a little bit about the role of public health and how that's represented in the guide.
Thanks, Kerri. So public health already plays a vital role in building climate resilience and protecting equity. So this graphic from the guide shows how public health's core functions already support climate action, often in ways that go unrecognized. Health promotion, surveillance, emergency preparedness, these aren't just climate aligned. They're essential for reducing climate risks and protecting health equity. From issuing air quality alerts during wildfire smoke, to advocating for heat protection bylaws, to helping local governments plan for more walkable green neighborhoods, this is already part of public health's work and are all climate resilience actions. Public health teams also play a critical role in upstream work, like advocating for healthy housing policies, supporting inclusive zoning, contributing data to walkability and active transportation planning, and helping ensure equitable access to parks and green spaces. And public health professionals are uniquely positioned to bridge gaps across sectors, as they are already collaborating with municipalities, Indigenous partners, planners, and community groups. This guide takes these core public health functions and leadership as a starting point and looks for ways to integrate and strengthen those intersections and co-benefits between climate action, health equity, and the built environment. Next slide, please. So when we began this work, the advisory group was asking, what's the most strategic entry point for public health professionals to advance equity-centered, climate resilient, and healthy built environment action? So we really kept coming back to the built environment as a scaffolding of daily life. So housing, roads, transit, parks, and food access. These systems shape our exposure to climate risk, but also capacity to respond through shelter, mobility, or social connection. We know that built environments can reduce vulnerability or worsen it. Whether someone has access to shade, clean air, safe housing, walkable streets, or reliable food depends on these systems and structures. So this guide focuses in on those intersections where public health can influence upstream decisions that will shape health outcomes and key factors that influence risk and resilience to climate change for decades. If this framework looks familiar, it should. It builds directly on the 2018 Healthy Built Environment Linkages Toolkit developed by BC CDC and this great network of the HBEA. That toolkit laid the groundwork by making clear, evidence-based connections between planning decisions and health outcomes. Building on that work, and many other guides that have been recently published over the last few years, this guide integrates a climate and equity lens to a healthy built environment framework, highlighting not only the links to health, but how those links are shifting under the pressures of climate change and how they show up differently depending on who you are, where you live, and what systems you can access. So the framework, as you can see on the slide, covers 6 pillars of the healthy built environment, including community and neighborhood design, transportation networks, housing, food systems, natural environments, and also social cohesion and well-being. This framework is grounded in the 4 principles on the outer part of the framework, including health equity, climate adaptation, climate mitigation, and low carbon resilience. For each of the 6 pillars, the guide provides examples of climate and health co-benefits, opportunities for action, including some practical ideas for collaboration with external partners, and key talking points that can be tailored to the specific needs of different community partners for both rural and urban public health units. I'll now turn it back over to Kerri, who will lead us through the sections of the guide focused on housing.
Yeah, thanks so much, Nicole. So I think in the guide, we're just starting with this basic premise that housing is a core determinant of health. So it shapes not just how we live, of course, but whether we're protected or exposed to some of those health risks associated with the changing climate. And I think it's one of the clearest and most consequential intersections between climate change and health equity. We see it during every climate-related emergency. The underhoused and the poorly housed populations are consistently at highest risk and often most exposed. And in a lot of the work that Shift has done around understanding the lived experience of different populations to climate-related events, I'm always struck by how housing is such a central theme. So for example, during extreme heat, people living in upper floor apartments without air conditioning or in poorly insulated homes often face serious heat-related illness. During wildfire smoke events, those who don't have access to clean filtered air are often living in older, poorly maintained buildings. They face heightened respiratory risks. And then in the case of flooding, where housing is located and what kind of housing is built matters deeply. This image on the screen here is actually in a neighborhood in Grand Forks, BC, following their major flood that happened in 2018. So I think we'll hear about this more from the Canadian Climate Institute today, but homes built in flood-prone areas leave residents more vulnerable to both that initial hazard, but also the long-term health impacts of displacement and mold and infrastructure damage. I think also beyond acute climate events like wildfires or flooding, overall substandard housing obviously leads to chronic health conditions, things like poor ventilation or dampness or inadequate cooling. And these risks will fall hardest on those who are already facing barriers. I think a key message of the guide is that housing is not just an infrastructure or an affordability issue. It is those things, but it's also a climate resilience and public health priority. And if we get housing right, we're not just responding to climate impacts, we're addressing one of those root causes of vulnerability in the first place. So it's an area where upstream decisions about planning and design can really shape health and resilience outcomes for decades. Next slide, please. So just a couple more slides here, and just to give you kind of a sense of some of the more concrete types of kind of co-benefits that are kind of illuminated through the guide. This is just an example, but some of those kind of multi-solving opportunities that the guide provides are things like retrofitting homes, so adding insulation or improving ventilation or switching to heat pumps. They're reducing emissions, but it's also improving indoor air quality. It's lowering utility bills, reducing energy poverty, and protecting residents from extreme heat and cold. So that's climate mitigation, health protection, and cost savings kind of all in one. With new developments, there's a good opportunity to be designing for the future climate. So we can be building homes that are resilient to flooding and smoke and heat, but also bringing in health and equity lens to where and how we build. Housing needs to be urgently built. Where we build it needs to be strategic, avoiding those high-risk areas about wildfires and flooding, but also at the same time ensuring access to transit and green space and community services, and integrating features like passive cooling and air filtration and natural environment protection. And then stable, affordable housing, supports mental health, it reduces financial stress, it strengthens community cohesion. It sounds obvious, but we know that people who aren't constantly forced to move or cope with unsafe conditions can build roots and relationships in community, and social connectedness is a major factor that determines resilience as well. So public health really has this role, as Nicole was saying, to help shape these upstream policies. Using health data is one way that they can do that. Yeah, I think we'll go to the next slide, which is about what public health can do. Yeah, so
Kerri,
this is
sorry. Yeah. We're a little bit just past your time for presentation and
no
questions.
problem.
So if you can just go pretty quickly through whatever you have left. Thank you.
This is the last slide.
Okay,
So and I don't think we need to read through all of this. I think this slide just really gives some examples of some of those actions for co-benefits that you'll find in the guide. So I encourage you to go to the guide to find more. I guess the one thing I would just say is that it also points out opportunities to prevent maladaptation, where really well-intended efforts can actually worsen inequities or create new risks. So For example, we can retrofit older buildings to improve energy efficiency and indoor air quality, which is a climate and health win. But if we don't have other protections in place, we can see things like rent evictions or residents being displaced. So the guide has some really, core messages for public health professionals to be using with their partners to help advance some of this work.
To introduce Wilma Leung. She's a senior manager in technical research and education with BC Housing. And Wilma brings decades of expertise in engineering, environmental management, and building design and construction. And at BC Housing, she leads technical research and education to improve housing. Recognized as an influencer in residential construction, Wilma champions collaboration for a resilient and sustainable industry. And she is going to be presenting about realizing resilient buildings. So over to you, Wilma. Thank you so much for being here with us today.
Thank you, and thank you everyone for welcoming me into this inspiring, healthy built environment co-learning space. There's a lot of similarity with the last presentation, there's a lot of coincidence actually, but I'll keep it light, and if you're interested, you can always go into the resources that I'll be sharing. We can start with the slide. Yes, BC has been facing growing threats from climate and seismic hazards. We all know that. We've been talking about extreme heat, wildfire, floods, droughts, and earthquakes. The 2021 heat dome and the massive floods that followed were tragic wake-up calls for us, and hundreds of lives were lost, homes destroyed, communities shaken. In response, BC Housing and the province, specifically the Climate Action Secretariat, have worked together to fund a project that's been undertaken on our behalf by PINA Sustainability to dig deeper. Together, they developed what we call the R2B discussion paper, which is the Realizing Resilient Buildings discussion paper, and the Toolkit, specifically for local government, to identify how we can make our buildings more resilient. The goal of this is to make sure that our homes, schools, and workplaces can keep people safe, comfortable, and connected, especially when things get tough. Next slide. Yes, thank you. So what was this project really trying to do? Very simple. It sets out to find the biggest barriers and the best enablers for building resilience in BC. It's a call for action for governments, for builders, for designers, for communities to move forward what they call climate compatible buildings. That means buildings that are not just net zero, but ready to face the storms ahead. Next. The research covered a range of buildings, from apartment blocks to housing in remote Indigenous communities. It focuses on how buildings can stand up to wildfires, extreme heat, floods, droughts, power outages, and earthquakes. What it did cover was neighborhood-scale planning. This is really about the buildings themselves, how they are designed, and how people live in them. A few key findings include that many buildings today just can't keep people safe in extreme conditions. Resilience must be about more than the structure itself. It has to include social connection and equity. This is resonating with the last presentation. And as we decarbonize building, we can't forget to make them climate ready too. Next. This research also advocates a concept called multi-solving. The idea is solving more than one problem at a time. So when we invest in low carbon buildings, let's make sure that they also stay cool in a heat wave or keep the air clean when wildfire smoke rolls in. Multi-solving means designing for carbon, safety, health, and equity all together. Next, the big picture. You don't get resilience with just one solution. You need a whole toolkit of enablers. This report has identified 32 in total. Each one tackles multiple barriers, and often one barrier needs more than one enabler to overcome it. Here are the big 5 enabler categories, including data and information like hazard maps and resilience rating systems, awareness and capacity, including training and recruitment, expert support, policy and development, including codes, public procurement and regulations, investment and financing, including incentive, cost benefit to support for retrofits, social resilience, including building design that help people connect and support each other. So let's look at how this relates with the problem or the barrier, and how the in terms of data and information, one of the problems is that people don't know the risk. So the solution is to provide public hazard database and better disclosure. Another problem is that not enough skilled people to build or inspect resilient buildings. So the solution is to provide more professional training, resilience, and support teams. Another key problem is resilience isn't baked into the system yet. So the solution is for public sector leadership and building code updates. Another problem is it costs more upfront and financial options are limited. So government incentive and better return on investment tools are necessary. So the other problem is that buildings tend to isolate people. So the solution for that would be support designs that support the community. Like the example of a Vienna house in Vancouver recently. Next and next. Yes, back one. Sorry. Yeah. This study also looked at the slower creeping stresses, things like rising sea levels, shifting rainfall, or warmer winters. These chronic changes affect the buildings too. It affects the life of the building, the durability, the surface of the buildings, etc. We need to be ready for the snow burns, not just for the big shocks. Next. The report says we shouldn't treat emissions and resilience as two separate tracks. Designing for one should help the others. Example, some mentioned earlier, a tight, efficient building envelope. They also keep the heat out. Passive cooling, that's great for energy saving as well as for human safety. Solar panels with battery storage, that keeps the lights on when the grid goes down. Smart design is design that does more than one job. Next. Equity is central to this conversation. Some groups are hit harder than others. Indigenous peoples, renters, seniors, and folks with chronic illnesses. The study also includes a separate report focused on how BC Housing can work more in partnership with Indigenous communities and First Nations. Resilience has to be done in ways that protect and include the most vulnerable. Next. So what about the toolkit? It's a hands-on guide for local governments. It shows how zoning, bylaws, incentives, and policies can support resilient buildings tailored to local risks and realities, and is especially helpful for smaller communities, but that might not have full-time technical staff or dedicated budgets for resilient buildings. Next. Let's revisit the 2021 heat dome. Most of those who died in their own homes. That tells us everything we need to know. Buildings must be safe in extreme heat. The report recommends passive cooling and insulation upgrades, cooling zones in multi-unit buildings, shaded outdoor areas, backup power for cooling systems. These are not nice to haves, they are lifesavers. Next. Local governments can lead the change by changing how buildings are designed and approved. For example, allow new forms like single-stair buildings or open-air corridors. Use development permit areas to require hazard protection. Offer incentives for going above code. Set the standard by upgrading public buildings. Our recent project, Vienna House, mentioned again here, is a model built for people and not just for performance. It used a tool called fluid sociability to evaluate the layout that will promote the most social interaction. Next. This isn't something that any one group can do alone. Building resilience requires teamwork. The province and Ottawa for codes and funding, local governments for land use and permitting, designers, builders, and engineers for the nuts and bolts, Indigenous nations for self-determined solutions, insurers and lenders to shape the market, and the public to push for and be ready to live in these buildings. The message is clear. We all have a role to play. Next. The report offers 37 specific recommendations. Some of the highlights include build public hazard data systems, add resilience into land use planning, fund on-call expert support teams, back new building methods with policy and funding, improve financing for retrofits, promote community-oriented building design. Implementation will take leadership from the province and collaboration across sectors. It's time to shift from reacting to leading. Thank you.
It will review anticipated risks of rapid housing density, policy gaps and potential opportunities to align housing development policies to minimize impacts without compromising the overall supply of new homes. And presenting is Sarah is a research lead with the Sustainable Finance team at the Canadian Climate Institute, where her work focuses on mobilizing the private sector to support resilience and energy transition. Sarah was previously Director of Policy for the BC Greens and has worked as an independent consultant providing policy advice, facilitation, and strategic planning services to nonprofit organizations and governments. And Sarah holds a master's, I think, in philosophy from the University of Oxford and a Bachelor of Science from the London School of Economics. Welcome. And Ryan Ness has 20 years of experience in environmental management and climate adaptation, integrating technical analysis, strategy development, and policy implementation. And previously, Ryan was the lead for climate adaptation programs and corporate strategy at the Toronto and Regional Conservation Authority, and also managed the Ontario Climate Consortium. So thank you and welcome to you both, and please take it away for your presentation. Thank you.
Thanks very much. I'll start and Sarah will jump in a minute. Can I just get a thumbs up to confirm that my screen is sharing? Excellent. Thank you very much. So yes, thank you for that kind introduction. I'm Ryan, the Director of Adaptation at the Canadian Climate Institute. We're a climate policy research center whose job is to advise the federal government and other governments in Canada on the policy options and trade-offs and decisions that need to be made to pursue our climate change goals. And Sarah and I, when we worked on this report, both worked on the Institute's climate adaptation team, but we also work on mitigation and economic transition policy and sustainable finance policy as well, which is where Sarah is now working. I'm speaking to you today from Toronto, from the traditional territory the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Wendat peoples. And I'm again pleased to have this opportunity to talk to you. We're going to briefly talk about the Institute's research, what we published under the title of Close to Home, How to Build More Housing in a Changing Climate, which examined the consequences of continuing to build housing in harm's way, something that continues to this day in Canada, and solutions to prevent this from happening. So we decided to carry out this research because we found that not enough was being done across the country to prevent new housing from being built in areas that are at risk of flooding and wildfire, which are by far the most damaging climate hazards to Canadian homes and communities. At this moment when policymakers are throwing everything they have into accelerating the pace of housing construction. Evidence shows that despite mounting losses to flooding and wildfire, we continue to build houses in areas prone to those hazards, and a push to accelerate housing supply without considering the misaligned incentives and policy gaps that allow housing to be built in dangerous places stand to dramatically increase the flooding and wildfire risks and costs and impacts across Canada. And ultimately, these costs will undermine the very affordability goals of boosting housing supply, not only for the households and communities that will be directly impacted, but also for all Canadians in the form of increased insurance premiums, tax-funded emergency response programs, and disaster relief. And of course, while the financial impacts were the focus of this report and the audience we were trying to connect with, there are obviously health implications for increasing the exposure of housing and families and households to flooding and wildfire, as has been so eloquently discussed already. So the approach to our analysis was to look at where under existing policies, community plans, zoning plans for individual municipalities across the country, where the 6 million or so homes that the federal government says need to be built by 2030 to restore affordability would end up being built. And we modeled the risks from flooding and wildfire to Canada's existing residential buildings, about 16 million of them, as well as 6 million additional new homes that might be created using risk and damage models that are most often used in the financial services and insurance industries to assess what the impact and the damage would be. Which Sarah's also going to talk about later. Our examination of the gaps and misaligned incentives in land use and housing policies that allow or encourage housing to be built in dangerous places, and looked at how the good practices from Canada and other places might help us address those gaps. And while we don't have time to talk about it enough today, in recognition of the unique and complex challenges and different policies that affect Indigenous communities, particularly First Nations communities on reserve, in building and planning climate resilient housing, we also commissioned separate research on those issues and challenges and solutions which are being advanced by many Indigenous communities, and that was published alongside our report. So I'll just quickly go through some of the results of the modeling. In the flooding scenario, we look at a best case scenario, which assumes that we have flood protection measures in place up to sort of the best standards, which we know is not the case in Canada. We also have a worst case scenario in which no protection is in place. There's really limited information on flood protection infrastructure in Canada, but we know we're probably closer to this worst case scenario. And we find so that in a best case scenario, which is probably, as I indicated, an over-optimistic projection, average annual flood losses to homes from new building within those 6 million new homes across Canada in flood vulnerable areas would increase losses by about 340 million, or about 20%. But in the worst case scenario, that risk could increase by 40%, or around 2 billion annually. The total amount of new damage varies substantially from province to province and territory to territory, depending on the number of homes, that are going to be built, and whether or not a substantial proportion are going to be built in risky areas. We see that, in Ontario and Quebec, the total losses are quite high, as indicated by the size of the water drops, but the per home losses indicated in the bars and the graph within them are actually quite low in those provinces because they have quite strict policies. In contrast, the losses per new home in places like Alberta, Manitoba, and British Columbia are much higher because of more lax policies that allow development in risky places, with the sort of obvious consequence that a greater proportion of new households will be impacted or be exposed to flood hazards. One of our most important findings is that it's a relatively small number of new homes that are responsible for most of the risk. Of the 6 million homes that stand to be built to restore affordability, about 10% of these under existing policies and zoning are likely to be built in flood-prone areas. However, less than 3% of the total will be responsible for most of the financial losses and accompanying sort of physical risk and follow on both acute and chronic health risks. So the takeaway here is that on the whole, directing just a small proportion of new homes away from high-risk areas can reduce most of the potential new risk from flooding. We don't have to throttle the supply of new housing in order to avoid these risks. We just have to be smart about a very small proportion of it. On the wildfire side, our results also show that risk could increase significantly under current land use and housing policies, potentially more than doubling doubling the losses, financial losses from wildfire across the country, even though the total number of homes would only be increasing by about a third. The majority of this potential new risk is concentrated in British Columbia, where rapid population and housing growth is forecast in fire-prone areas, particularly the interior. New housing in the province could increase annual wildfire damage to homes and communities by a factor of 3. Wildfire risk, like flooding, is also concentrated in a small number of places. Our analysis suggests that 92% of losses will be concentrated in just 20 municipalities and communities. 16 of those are in the British Columbia interior. So this, again, like our flooding analysis, suggests that most of the risk can be reduced by concentrating on building in safer places in a relatively small number of municipalities and regions, making sure that those, again, relatively small number of potential new homes are constructed in safer and different places. Oh, apologies, the animation was slow to show up there. I will now flip it over to Sarah, who's going to talk about our policy analysis, what we concluded about the state of policy in this country, both nationally and regionally, and some of the opportunities to improve the gaps that are allowing risky housing to be built. Sarah.
Thanks, Ryan. I think just looking at the time, I might actually ask if you want to forward the slides to the key conclusions, and I can just speak briefly about our key conclusions and recommendations so that we have a few minutes for questions.
Sure, let's do that.
We do a much deeper dive in the report into many of the policy barriers that exist, some of the challenges with existing programming that are contributing to escalating risk, especially as a lot of new housing is being built, but don't have time to get into all that detail here. So just briefly, based on the analysis that Ryan just presented on the extent of the risk that already exists and that we're likely to see in the coming years, as well as our policy research, we make a number of key conclusions. So we have 5 conclusions. The first is about the scale of the risk that exists and the damages that we can expect, as Ryan just spoke to. The second conclusion is about one of the primary policy drivers of this. We found that across the country, while there's a wide variety of land use policies at the provincial and territorial level, generally in most jurisdictions, they're fairly permissive. BC actually stands out as one of the jurisdictions with the most permissive land use policies, where the province doesn't play an active role in setting certain standards or requiring any particular policies at the local government level, really leaving it up to local governments, who I'm sure many on this call can attest, often face significant capacity challenges and a lot of political pressure, particularly as they're under pressure to approve a lot more housing rapidly. The third conclusion is that, as Ryan mentioned, it's actually a relatively small number of homes that are driving the vast majority of the losses that we can expect, which is a good news story in terms of we can still hit the housing targets that we need, build out housing supply to the level required for affordability purposes, while really dramatically reducing the losses that we expect if we just steer the highest risk homes away from these high hazard areas and towards safer ground. Then our fourth conclusion is about the importance of other policy gaps, particularly when land use policy is relatively permissive. So we looked at infrastructure and housing policy, as well as disaster assistance at all levels of government, looking particularly at the federal government, and found that there isn't adequate consideration of climate hazards, particularly flooding and wildfire, in how these policies and programs are designed, which are worsening the challenge. And then our final conclusion is about the lack of good information, which is really hampering smarter housing decisions and holding governments back. And then I'll just flash up the recommendations. I won't get into them all here. Maybe Ryan, if you just want to put them all up on the screen. We make a number of recommendations aimed at all levels of government and go into much more detail in the report, but essentially around ensuring housing and infrastructure investment supports more development in lower hazard areas away from high hazard zones, strengthening land use policy at the provincial and territorial level, reform to disaster assistance to reduce the moral hazard that currently exists and still exists despite some recent improvements, and the rapid provision of improved hazard information, as well as some changes to mandate disclosure in real estate transactions. And then lastly, I'll just mention as Ryan mentioned, we also published a report, a standalone report, looking at some of the challenges in Indigenous communities. We also, our Indigenous research stream is publishing a report on healthy energy homes that may be of interest to many of the people on this call. So I'll just drop the email of our research director on that team into the chat, and she indicated to me that she'd be very keen if anybody would like to speak to her about health challenges, the importance of healthy homes in Indigenous communities and on reserve in particular, that she'd be really keen to talk to you. So I will do that. And I think I'll leave it there to leave a couple of minutes for questions.